Hello, this is Kim McAllister, and we're going to talk about Health Education Part 3. We're going to discuss empowerment and also just assessing using the nursing process in health education. So using assessment and intervention, evaluation, and so forth. So empowerment is the act of giving people the tools that they need to make good decisions about their health, also giving them the information and helping them gain control of their health care and of their state of being, their health. We focus our empowerment in general on our vulnerable populations who may not have the tools that they need or have the information that they need to improve their health. So this helps to improve their conception of health. This helps to separate the individual from their health status. Have you ever heard somebody say, well, I got to take care of the diabetic in room 302? That's very dehumanizing, and people are more than their diagnoses, and they're more than their problems. And so when we empower people, we're recognizing that and giving them back their humanistic characteristics and qualities. This also helps to minimize associations between people and their difficulty in managing health and illness. For instance, sometimes we label people non-compliant, or we say this person is difficult. When we empower them, we're giving them the ability to overcome those labels and also reminding us that we don't need to be labeling people to begin with. So empowerment is going to look at social, political, and economic aspects of health. Social may have to do with, are they living alone? Are they living with people that are impeding their health? It can have to do with how do they get to their healthcare appointments? Do they have somebody to help them, somebody to assist them? Do they need someone to assist them? Is their illness keeping them locked inside their home? Do they have the ability to interact with other people? Political. There is a great upheaval going on right now in our healthcare system. How do we empower people to deal with that and handle the ramifications? We can teach people to write their congresspeople and contact their other representatives. We can teach people to become involved in grassroots groups that deal with their particular health concerns or needs. And then we look at economics. How do we help people maximize their health care dollar? Are they in the right insurance plan? Are they taking advantage of prescription discount cards? Have they notified the manufacturer of their medication that they're having trouble paying for their medication? Are they utilizing their health benefits in a way that is best for their health condition? For example, if their health insurance covers a variety of preventative services, are they taking advantage of those preventive services? Do they know they have them? You can rock people's worlds by having them show you their insurance card and showing them the phone numbers and showing them the contact information, the website, and other information that's on that card that will help them find out what providers they can use, what other services they can use, giving them the tools to contact and find out when there are problems with their claims being paid. All of these things are very important for patients, and a lot of people don't know how to do that. When we're talking about empowerment, we also want to look at race, ethnicity, education and literacy levels, gender, and class. Different races and ethnicities are prone to different types of illnesses, and so you want to tailor your educational program to empower people that are having the specific issues due to their race and ethnicity. You also want to provide that education in a way that is fully beneficial to them and that recognizes and celebrates their differences and their diversity and their rich culture. You want to evaluate their education and their literacy level. You want to know, can they understand the instructions that we're giving? We'll talk in a moment about health literacy, their ability to understand health care information. They're not always the same. Some people may be very literate but have a great deal of difficulty understanding some of our literature. A lot of brochures and information that we hand out to patients are written at college level and beyond, and information should not be written at that level for the average population. So we need to make sure that they have information, and they have information that they can actually use and benefit from. We also want to look at gender. People, depending on gender, may feel more empowered or less empowered, and we want to make sure that we put them in the optimal seat with that. And we also want to look at class. What is their socioeconomic status? Is there some other class or classification that they consider themselves to be a part of? We need to know all of this so that we can fully prepare a program that is tailored to them. So the core concepts of empowering are providing information, getting communication, and also providing health education. So we want to find out what information the person already understands and what information that they need. We want to find the best way to communicate that to the patient. Is a class the best option for the patient? Is this someone who's really social and really learns from talking and interacting with other people? A class might be better. Is this someone who's easily distracted and needs something that's one-on-one? You have to figure out the best way to communicate with your person. And then health education is, and giving them the specific health education that they need is very empowering because it helps to give them the tools that they need. When we are working with empowerment, we want to empower our individuals, we want to empower their families, and we want to empower groups. Remember, this is community and public health, and our focus is on populations. So we might best help people by going where groups of people congregate. For example, I've done a lot of diabetes education at Senior Center. Type 2 diabetes is, people are more prone to that after the age of 40 and 50. And so by targeting senior centers, you can identify people that need this type of information, and they're also more prone to other chronic diseases and problems. And so it's a good place to go and provide that information. You can also look at groups in other ways. You could look at everyone who is in this particular community, or the people in this particular community that were all exposed to a restaurant worker who had hepatitis A. So everybody who ate at this particular restaurant on these days might be asked to come to a group meeting, and then you would go over information about what had happened, the signs and symptoms to look for, explain what they were going to be doing in order to be screened and tested and so forth. So that would be a way of empowering people who had been through something like that. So with empowerment, the nurse is the facilitator and educator, and you are the resource person. You're providing information, you're facilitating and educating the event, and you're an equal partner with the learner. So it's not, you're not going to arrive and say, okay, this is what you must know, and now I'm going to impart this to you. To fully empower someone, you have to meet with them, find out what their needs are, what they're looking for, what their educational level is, what all the information and factors that we've already talked about, and then determine with them the best way to give them the information and to actually isolate and decide what information that they want. So as they go through this process, they may decide, you know what, I need more information about this, or I need more information about that. And so you are a continual resource to the people that you're empowering, so that they can come back and get the information that they need. And you're an equal partner with the learner. You're not in control. You are standing beside the learner and helping them. So we use the nursing process, of course, for everything we do as nurses. And just like you would use that for caring for a patient in the hospital, we will also be using the assessment process in health education. I've already alluded to many times already that we need to identify what people's educational needs are. That can be from finding out what the person wants to know and what they don't know. Also, someone may be dealing with a new disease or a new threat, and they may not understand that these are things that they need to know. And so we work with them to find out what they need to know, and then we try to persuade them about things that they necessarily don't think they need to know, but they do. We determine what motivates them. We go back to looking at our different learning theories and figuring out the best motivation for them, and then setting priorities. Unless you start to address things that are a priority for the patient, they may not be willing to listen to you, suggest other ideas that are priorities. So with someone who's newly diagnosed with diabetes, your focus will want to be on teaching basic survival skills. That patient may not be as focused on that. They might be focused on something else. And so you have to help them understand what the importance is of the survival skills, but also let them know that you hear them about what their needs are and that you're going to work with them on that. So you want to design goals. You want to design specific educational goals. After you have set the priorities and you've identified what the learner wants to know and what you believe the learner needs to know, and so you're going to set out goals. And remember, the goals need to be simple, they need to be measurable, and they need to be achievable. So you have to have something that is something that you can accomplish with the patient or the person or the group. You also have to have something that you can actually measure. And you need to have a specific time frame also of when this is going to be accomplished. So after you make your goals, then you want to set out your objectives. Your objectives are the things that you need to do in order to reach the goal. And then you need to determine what method you're going to use. How are you going to present this information? Are you going to maybe provide some explanation or a small lecture? Are you going to provide handouts and materials for the person to keep? Are you going to demonstrate something like how to draw up insulin, or showing someone how to take care of their new stoma? These would be things that you would carry out and demonstrate. So you need to decide, is this something that is a psychomotor skill? Do they need to see it demonstrated and explained? And then is there a way we can have them do a return demonstration? Who needs to be a part of this process? Do they have other people who will be caring for them? We need to arrange for them to be present and engaged. So then we're going to intervene. We're going to actually carry out this teaching plan that we have made and do it. And while we're doing this, we want to be flexible because the person's interest may tire, or they may not be able to participate as fully as planned. They may suddenly decide they want information on something else. And so you have to be flexible and be willing to do some give and take with that. And then you want to be dynamic. You want to be interesting. You want to deliver your information in a timely manner. And you want to do it in a way that has meaning and is at least informative and captures the person's attention. So when you evaluate the plan, you need to go back to your goals and decide if they were met. And this is really simple to do if you've made your goals very measurable and identifiable and you've given a time frame. You know, have we met this objective and did we do it in the time that we said? If the goals were not met, why were they not met? What do we need to do to get those goals met? Do we need to try a different tack? Do we need to develop something different for the patient? If the goals were met, how well were they met? Did the patient kind of understand? Did they sort of get it right? Did they do it, but they needed support while they were doing it? All of this is important. And then you need feedback. You need feedback from the person receiving the educational material. Did this work for you? Did this meet all of your needs? Is there still information that you'd like to know? So this is, in a nutshell, is how to provide empowerment and how to use the nursing process with the education process.